Welcome back, Dr. Linda here. We are going to be looking at the holes or the foramen of the skull. So let's look at the inside. When we look at the inside, we can see that we do have a bunch of holes around here. And it's important to know what they're called and what's going to be traveling through them. So let's take a look, and we can see in the ethmoid right here, we have the olfactory foramen. Well, the olfactory foramen is part of the ethmoid bone, or that cribiform plate. The olfactory foramen is for the olfactory nerve, for the sense of smell. Okay, now I do have another picture that has a picture of these holes, and on one side, half of it, it's going to tell you the foramen, and on the other half, it points to the same structures, but tells you what cranial nerve passes through them. So we'll have a separate video for that. So when we look at the sphenoid bone right here, the bat bone, we have a few foramen here. We have foramen rotundum, foramen ovale, and foramen spinosum. So it kind of goes on this diagonal, and it's ROS, R-O-S, foramen rotundum, foramen ovale, and foramen spinosum. More medially located is a foramen lacerum. Now, lacerum comes from the word laceration because it's this elongated slit, right? It's this foramen that's kind of long and elongated, like someone took a knife and lacerated that part of the bone. So they call it foramen lacerum. Now remember, on the outside of the ear going in was the external acoustic meatus. On the inside is the internal acoustic meatus. The largest hole of the skull is the foramen magnum. Magnum means large. So foramen magnum is this large hole, and what's going through the large hole is going to be part of the brainstem called the medulla oblongata. That's going to travel down through the magnum foramen and will be protected by C1 vertebrae and the C2 vertebrae. So in most anatomy books, they'll say the brain is in the cranial vault, and what's inferior to the magnum foramen is spinal cord. And the reason why most dissection books say that, it's because when we do dissections, the body is dead. And when the body is dead, we lose water, there's dehydration. And when there's dehydration, the tissues ascend, or they pull upward. So the medulla, when we do dissections, is found above the magnum foramen, but on functional MRIs, we can see the medulla oblongata, which is part of the brain, descends below the magnum foramen and is protected by the top two vertebrae, C1 and C2. C1 is called the atlas, and C2 is called the axis. Atlas and axis. Here, right there, we see a hole, and there's another one here. That's called the hypoglossal canal, and that's for the hypoglossal nerve, which is cranial nerve 12. And then here is the jugular foramen. That's the jugular foramen, and we're going to have some of the jugular veins travel through there. Okay, what foramen do we have here around the eyes? So here was the supraorbital ridge, but there is a fossa called the supraorbital foramen right there. Then below is the infraorbital foramen. Inside the eye, we have the optic canal. That's for cranial nerve number 2. Then we have two fissures. Now fissures are more of like an elongated hole, right? So this is more elongated. So there's a superior orbital fissure, and then there's an inferior orbital fissure. And on the inner part of the nose, right here, on that medial part of the orbit, is the nasolacrimal canal. Remember, your lacrimal gland is going to be up here, and the tears are going to flow in this direction. And eventually, all the tears are going to come out into the meatus. And those tissues in the nose are going to swell as a result of a histamine reaction, giving you that stuffed nose type of feeling. And since we're on this picture, there is, let's see if I can erase this for a second. And let me bring back red here. So here's the supraorbital foramen, infraorbital foramen, and then here's your mental foramen. So here is where cranial nerve number 5, this is Roman numeral 5, it's called the trigeminal nerve. Trigeminal because there's 3 branches, 1, 2, 3 branches. So we call them V1, V2, and V3. And again, the V is for Roman numeral number 5, trigeminal nerve. It just has 3 divisions. And these are the nerves that your dentist is going to hit with Novocaine so that your upper jaw, the V2, the maxillary division, and V3, the mandibular division, get numb so they can work on your teeth and you don't feel the pain or discomfort. The V1 branch is called the ophthalmic branch. So when Novocaine is administered, usually you go numb on the entire half of the face, right? Including your tongue. That's why they don't want you eating, because you can't feel pain. So you have V1, V2, and V3. That's the route for which the trigeminal nerve travels. There are people that get a virus of that trigeminal nerve, and it's called trigeminal neuralgia, where the patient gets lightning pain to their face with the subtle stimulus of a wind blowing or very, very light touch. It is excruciating. It's considered the most painful neurological condition on the planet, and it's considered to be suicidal-like pain. Let's look at the foramen on the underside of the skull. Okay, so here is the incisive foramen. Here is the carotid canal. Here is the mastoid process right here. And then here's the styloid process. And between the two is the stylo-mastoid foramen. It's that hole between the mastoid process and the styloid process. Okay, and here is the jugular foramen. There's the jugular foramen, and then here's the carotid canal. And again, on the underneath surface, right there's the magnum foramen. Here's the occipital condyles. Here is the medial pterygoid process, the lateral pterygoid process, just a few different refreshers of some information that we've covered. What are the foramen on the side of the skull? Well, there's the external acoustic meatus. That's where sound waves are going to penetrate through. There's the mastoid process, and again, there's the styloid process. Here's the mental foramen. Here's the supraorbital foramen. Here's the infraorbital foramen. This is for V1, V2, and V3. And again, the V is for Roman numeral 5, trigeminal, tri, because there's 3 divisions.